serious issues with regards to unemployment as well. Poverty, inequality, it's compounded by the deleterious effects of COVID-19. So we want to know from you, how's it affected your life? At the agenda_SABC. While South Africa battles COVID-19 at the forefront of the war against the invisible enemy are health workers. Among those health workers is Dr. Vusumzi Mehlo, a clinical manager at St Barnabas Hospital in the Eastern Cape. He has gone the extra mile to save COVID-19 patients, even driving an ambulance during this pandemic. St Barnabas is one of the hospitals with low infections among its workers.
Whereby we were preparing the staff within
the battle against COVID-19 is far from over. Dr. Mehlo is one of hundreds of health workers committed to saving lives as the manager at St Barnabas Hospital, servicing thousands of villagers from Nyandeni. The hospital is responsible for the recoveries of 30 patients who were infected at a funeral in a nearby Port St. John's.
I think we're the first institution in our time to treat COVID, whereby we had plus 20 patients that were confirmed with COVID within our institution. What was great was that the outcomes were good. We didn't have any patient that died from COVID from those patients. They are all discharged back to their community now. And then we continue to have newly diagnosed people with COVID. We still continue to treat them. Currently, if I can estimate, we've treated more than 100 people within the institution. And the outcomes are very good, just because out of 100, less than 5 people that we've had dying in the hospital.
Hundreds of COVID-19 patients have been admitted to this hospital with less than 5 deaths. When one of the patients had difficulties breathing, Dr. Mehlo took it upon himself to drive an ambulance to a nearby hospital for additional help.
The ambulances were dispatched to other areas. Then I ended up driving the ambulance that day for the first time like that. And my interest was to act in the best interest of saving the patient's life. So what I did, it was just for the patient to survive and then to have life after COVID. Maybe someone else would say that was something abnormal. But to me, since it's a calling, I can do anything in order to save any person's life.
The health department is besieged with protests in the area, with health workers from 49 clinics remaining on a stairway. It depends on such hospitals to offer services to people coming from far-flung areas.
There are 2 hospitals that have really demonstrated commitment in the fight against COVID-19, which is St Barnabas Hospital as well as the Tulele Hospital in Kanduli. Those hospitals went straight and put their hands on deck and started admitting people outside their catchment area. Dr. Mehlo admitted 30 people from Majola who were supposed to have gone to Isilimela, but they came to here in Libote.
The health department has pleaded with its workers to continue assisting their communities like Dr. Mehlo. The department says it's in the process of setting regulations that will prohibit the closure of health facilities.
To understand that this is a crisis that needs everyone. So this is encouraging, and we continue to encourage those men and women who remain committed to the fight. We are aware of the challenges, we are aware of anxiety that has been demonstrated. We are dealing with those challenges.
The infection of staff members remains low at St Barnabas Hospital. Out of 400 workers, just 15 have been infected, with 7 already back at work. Luandi Lembulali, Nklaza in the Eastern Cape.
All right, so we're going to take a quick break. When we come back, we'll continue our special focus on the impact of COVID-19 on